1:30 on August 9th, we'll call the Health and Human Services Board to order. We'll begin with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I do need help there. All right, so.
We do have Chris on.
Yep, and just everybody noting Commissioner Hewson is there on the virtual end here as well. So with that, we'll start off with approving the minutes from the July 12th Health and Human Services Board meeting.
I'll make a motion to approve the minutes.
Second.
Motion by Commissioner Dahlheiden, second by Commissioner Wetter. Any further discussion? Hearing none, all in favor, roll call vote. Commissioner Hewson?
Aye.
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 All right, the minutes are approved unanimously. Today's agenda.
I have nothing to add or omit.
I'll make a motion to approve the agenda. Yes.
I'll second.
All right, motion by Commissioner Dahlheiden, second by Commissioner Ketchmark. Any further discussion? Roll call vote. Commissioner Hewson?
Aye.
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 Agenda is approved unanimously. Today's consent agenda.
Mr. Chair,
Yes.
I'd like to pull A for further information.
All right. And a motion to approve the,
I'll make a motion to approve the agenda with A pulled.
I'll second.
motion by Commissioner Dahlheiden, second by Commissioner Wetter. Roll call vote. Commissioner Hewson?
Aye.
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 Motion, passes unanimously for the consent agenda. Item A.
Okay, my question was, first of all, is a joint powers agreement working well? Secondly, it says pooling of resources. Does everybody kind of pool into that? And,
Sure.
and what sort of resources makes up this for SNAP?
Okay, well, I'll do my best here, and if you have more questions than I can answer, I'll need to come back with more information. And this is actually from Kim Johnson's area, Financial Services. So the JPA exists, and it's currently, you can see on the first page. Do you have this document in front of you, or?
I've looked
So
at
there's
it, yes.
there's a number of counties on here.
Yes.
And the request is to add, is it Isanti County?
Isanti,
Okay.
yes.
So it's not necessarily county resources. We get a grant from the state of Minnesota to work through the Monticello,
Central Minnesota
Thank
Jobs.
you, Central Minnesota Jobs and Training, and they run this, they run the program for us for this, so they help individuals find jobs that are on food support, so they could then get off of food support. So it kind of actually helps Wright County in the sense by bringing another county in. The pool of money that's available to Central Minnesota Jobs and Training is larger, and they in turn work. It's actually, I don't think it's so no money's changing hands based on this. It does give Isanti some benefits by using the same resource that the other counties have put together. I would say that I see no issues with the JPA, that we all get along, and it's always been a very amenable agreement between everybody. I would just say that sometimes, it's hard to discern like the benefits or what they're working on, because we don't really touch it a whole lot. They're our clients, but they're kind of running the program for us.
Okay.
Yeah, we see this as really just a helpful thing. We're helping out a neighbor county, and that we in turn they'll have a bigger pool of money to work with to help serve all of our clients together.
Okay, thank you.
And if that's approved, I will hand it up to the,
You make a motion to approve?
I'll make a motion to approve that, let's see, the amendment to add Isanti County to the joint powers agreement.
I'll second it.
Motion by Commissioner Wetter, second by Commissioner Dahlheiden. Any further discussion? Roll call vote. Commissioner Hewson?
Aye.
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 And the amendment is approved unanimously. New hires. couple
Yes.
new people here joining the wonderful crew at Wright County.
Absolutely. We have first and foremost Samantha Martins, if you'd like to stand up, Sam. She is a new social worker in our child protection CP1 team. She reports to Julie Van Boom, who's currently out of the office on vacation, and Samantha started on July 19th. So welcome, Sam.
All right, now comes the,
The grueling questions.
so, where'd you grow up? Where do you live now?
I grew up in Brooklyn Park, Minnesota. I currently live in Maple Grove.
And why don't you live in the Wright County since you want to work for the Wright County?
To be honest, we just recently bought a place and no one wants to move around here. There's not many options.
There isn't many homes for sale in this.
See, that's because we're the Wright County.
She just likes higher Hennepin
Yeah,
County
your dad's
taxes.
down
That's what it
again.
is.
Thank you, Sam.
So did you come from a different county or?
Oh, I used to work at Volunteers of America.
Oh, okay.
So it's contracted.
And the child protection is always a great place to break into the social worker field in Wright County, and I'm sure Sam will do a great job, so we're very happy to have you with us.
Well, welcome.
Thank you.
Our second new candidate or new employee is Keith Bennett. Keith is our new health promotion coordinator. He's on the health promotion and we just changed the name Health Promotion and Protection Team. And he also started on July 19th and he reports to John. So welcome, Keith. Same questions.
Yeah, I know exactly because I listened to it this morning
Oh, okay.
in public health,
Well,
so.
that's true. You were at the task force meeting.
Yeah, so I currently live in Chanhassen. I'll be moving to Plymouth. But the reasoning for that is because my wife and I bought a business in China called Clothesment or franchise. So that's our kind of our middle ground. Plymouth, I get to commute here. She gets to commute. And also where I've grown, kind of all over the Midwest. Starting from Houston, Texas, all the way to Missouri, Illinois, and high school in Grand Forks, North Dakota, where I did, and I went to college at North Dakota State University in Fargo for my undergrad and graduate.
And Keith also had involvement with working, he did not work for a county, but you worked with counties under the same, is that correct?
Yeah, so I worked at Clay County Public Health, but it was a partnership with Ottertail, Becker, and Wilton counties. My jurisdiction was all 4 counties, and highly involved with SHIP, along with child teen checkups and numerous other programs.
And you just moved from Colorado, if I remember, from this
Moved
morning.
here from Boulder, Colorado, where I used to work at the University of Colorado Boulder.
Is this a new business with you and your wife, like a brand new startup business?
So it's a franchise, so this was there, but we bought it and kind of revamping our whole business plan.
Thank you, Keith.
Thanks.
Thank
Nice
you
to meet
both.
You're
welcome,
welcome.
Very nice. So, employee of the month for September.
Yes, let's see.
And it's a drum roll.
I would like to ask Brittany Haas to join me up at the podium.
Normally, it's not good when Jamie wants you to, but this is a good thing.
Step up to the
This is
podium,
a really
please.
good thing.
And I'll let you know, Commissioner Delighten, that Brittany does reside in this building. For the month of September, she is our employee of the month.
Okay.
So, Board, our September employee of the month is Brittany Haas, an Office Technician 2 in our financial services since February 2019. Brittany's strong work ethic and dedication make her the soul of her team. Brittany is a hard worker with high expectations of herself and someone you can rely on 100% of the time. In the past year, she's been the glue holding the financial units together and continues to ensure clients are being given top priority. Her nominator states in part, from day one, Brittany has grasped the understanding and the complexities of financial services procedures and delivered them with ease. She caught on quickly and by doing so was so helpful to others to be able to accomplish their jobs. Brittany has endured major changes, trained staff, she powered through staff shortages, as well as being the one constant for everyone to rely on. Brittany is always extremely calm, courteous, and takes on things with grace, even when the work is stressful. Brittany keeps it together and with a great sense of humor. One day, Brittany showed up to a Teams meeting with the Brady Bunch background. It was hilarious. I guess I missed it, but it sounds like fun. lighthearted, and made you smile. Brittany is a true asset, someone to count on, someone to trust, and she is easy to be around for both staff and clients. So thank you, Brittany, and congratulations on being our HHS September Employee of the Month. Thank you very much. I would just also point out that during the past year and during COVID, our office support team really did hold everything together while the majority of our staff were out working remotely and from home. These folks were here on a regular basis. They were the ones really kind of keeping the engine lit or whatever, the fire's lit and the engine going. So we really appreciate our office support team. You guys did a great job.
Well, congratulations.
Yes.
So down in the parking area, there's a sign.
Oh.
Down in the parking area, there's a sign for you that'll say Employee of the Month.
Oh, okay.
So starting September 1st, use that spot.
All right.
Just zing right in there.
Even on Labor Day, you can park there too.
Just for fun, just for giggles. Yep. All right.
Regular agenda, item A.
And I believe we have Kelsey and.
Yep, we're right here.
Well, there you go. Oh my goodness, I didn't turn around far enough. I'm going to turn this over to Sarah Grocius, our Public Health Director, to introduce our new Public Health Supervisor, Kelsey Collier. Kelsey, of course, is taking Mary Nesseth's place, who ended or retired from Wright County, May 31st?
28th, yep.
May 28th, yep.
I was going to say good morning, but good afternoon, everyone. This is Kelsey. We went through a little bit of a reorganization, and Kelsey will be taking over a team that now comprises traditional home visiting, our family planning and co-location programs, as well as CAC, and then we've added a disease prevention and control. So it's called the Collaborative Health Services team, and primarily they're working with other healthcare providers, and also 60 Plus and Healthy. I almost forgot that one because that's a very popular program. I should not forget it. Working with other community partners and systems to deliver the care in the community. Our primarily PHNs and case aides. I don't know if you have questions for Kelsey. She was
Here.
Yes.
So how long have you been with the county?
Almost 2 years now.
You might appreciate me saying this, but I'm going to say it anyhow. So when the pandemic response began, and Kelsey was prominent in that, and I thought she was an intern because she looked so young. And I thought, wow, we're giving a lot of responsibility to our intern, just to find out she actually was a public health nurse working in our division, and that she carried herself very well through that whole pandemic and was really worked well. I think you were working with the long-term care centers for a while and really heading up a pretty big component. So whereas she may look young, I'm informed that she is not that young. She is very mature and she has great experience that holds her up.
Well, I don't think Sarah put her in that position if she didn't think highly of you.
Exactly.
So congratulations.
Thank you.
Welcome.
I think making it through the COVID response, especially some of those intense first months, still with your sanity speaks highly for most folks. So, yeah, we have a pretty resilient person on our hands.
Yeah, she doesn't look quite as tired as you do.
I'm not sleeping these days, so actually that's probably true. She might
Is this
be
the
more
current
well-rested.
one? This is the current org, right?
Yes.
Yep. It's like that.
Yep.
The new teammate name should be across the top. So welcome to your new position, Kelsey. We're very excited to have you join our supervisory management team.
Again, congratulations.
She started the 26th, so
She starts or did?
did start the 26th. Yep.
Don't worry,
Congratulations.
don't worry, when you get my age, you'll be happy you look young.
That's what I'm hearing.
So where do you live? Do you live in Wright County?
St. Michael, yep.
Oh, okay. Which part of St. Michael? East of 19 or west?
I live behind the community bank.
Oh, your end.
Okay, you're in the
Oh,
east
wait.
part then.
The former Great
Right
Northern.
by JBS. JB? J&B.
J and B.
Yeah.
Yeah, okay,
Your side.
yeah. My condolences.
So when you want to complain,
Yes.
So yeah, if you have a complaint,
Complain to
call
him.
Wetter.
So far, I don't have any
No. I get enough complaints as it is.
How long have you lived in St. Michael? 30 years?
3.
Oh, okay.
3 years. I grew up near St. Cloud.
I don't know, my hearing, gotta get my new hearing aids or something. Well, good. Congratulations.
Thank you.
Yep, you'll be seeing more of her.
All right.
Good.
So, second item, the presentation on Code of America MN benefits pilot program.
So we have Stephanie Wiley, and our supervisor in this area, and would love to present the Code of America, how that's going. We're one of the pilot counties, as she'll explain. Do you want to be hooked up so they can see your, and then Commissioner Houston can see the presentation too?
Do you have Teams? Teams?
Mr. Chair, I can see the presentation on my computer.
Okay, we can. That's good. You commissioners, do you have this
I can open it up.
presentation
Yeah, I
in
can.
your?
I've got
Yeah,
it
I
pulled
did.
up on my agenda.
Okay.
I can pull it up
saved
on my.
computer and I only printed the necessary
No.
stuff.
Here. Here.
Have you got it?
I'm working, getting there.
Otherwise,
Oh, they got it.
I've got it in black and white. Not the title page or the question page.
You hit the the custom, or the
I printed it at
slideshow
home.
up on top. Again,
Put it in black and white. Shades of gray.
There you go, it's up.
Thank you. All right, well, thank you for having me. Yes, my name is Stephanie Wiley. I'm here today to talk about Code of America, which is our pilot project with MN benefits.
just hit your space bar, maybe.
Down arrow. Sledgehammer?
Now we lost.
That didn't work.
All along with yours, I'm not sure.
There we go.
So just to give you an overview, I'm going to talk about the history, the advancements, some of our county matrix, the survey results that we received from clients. Back in December, Wright County was one of 4 counties that entered into the pilot project. This, in the beginning, was only supposed to be a way for single adults to apply for the SNAP program, but prior to us even launching it here in Wright County, Code of America did enhance their ability, and we were able to take applications for all programs utilizing mnbenefits.org. So with this application, like I said, they can apply for SNAP, which is food, cash assistance, emergency assistance, childcare, and housing support. This is similar to Apply MN, however, the benefit of MN benefits is that they do not need to create an account and remember a user ID or a password, which makes it one of the reasons why most clients love this application process. In the advancements, benefits, like I indicated, the application doesn't require them to create an account. The average time it takes an individual to complete the application is 7 minutes. And also with us, it didn't require a lot of revamping or additional work within our integrated services or IT development. It flows right into our on-base. So that application, we were able to receive it every 15 minutes. It uploads into our live stream so that we can contact the client and start the application process. New releases in the spring of 2021, additional counties were added to the deployment. Those counties are Anoka, Carver, Clay, Cook, Dodge, Morrison, Ottertail, Sherburne, Steele, and St. Louis. Also, they added the feature of Later Docs, which is an application where they can upload documentation to support their applications for further processing. In the future, it looks like our time with Code of America is ending. They are transitioning off to minutes. Thank you. Yes. And also
Minutes, it's
Oh,
DA,
God.
I know.
so
We were hoping that maybe some of the rescue plan funds would have just supported this min benefits program, so we're hopeful, but
Well,
we have what our expectations are.
if Bennett leaves it alone, then we should be
That's
okay.
actually terrible for the clients because you teased them. Now you have all this into one bucket. Now, oh wait, by the way, now you have to just do it all separately again. Like,
Yeah.
oh jeez.
I know.
So we were hopeful that they would be maintaining it, and then with the addition of potentially adding healthcare, that was what their latest development that they were working on. So overall in the matrix, total of 21,805 applications have been received, along with the 5,133 documents that go along with those applications. I do have it detailed out. We are a medium-sized county, so those other ones that are a little bit higher, a bigger application total, but for Wright County, we've received 520 applications thus far.
I think that maybe got I think I monkeyed around with your document and I maybe made it go over the edge of the page.
It just blows my mind that Olmsted County had more than Anoka by double. I mean, especially because Olmsted County is roughly the same size as Wright County. I mean, for Anoka County, which is like 4 times the size, I'm still, especially because Olmsted County is relatively an affluent population, so.
Maybe they marketed differently.
Correctly, Olmsted has really done the ones that are have the scan front 400s already installed, so customers can scan documents when they go in. But I think they're also the county that installed application kiosks at their different so that people can really just utilize the MN benefits, not just in the county.
Mr. Chair.
Part of the first 4.
Yes, I'm sorry.
Question, now are these numbers like forever since day one, or is this just 1 year, or?
So those numbers are current from the time that we deployed for every county. So there's only that have been deployed,
So
but from the time that we
And so
started.
it's
December until July.
Correct.
Oh, okay.
And we're still getting other applications from the traditional means. This would have, just helped people get their application in without either having to come into the office, mail it in, get the papers, download them. They can just do it right on their, I think on their phone, not even on their computer. When you think about 7 minutes versus, and we've in years past, we brought in the whole application process, what it looks like to the applicant, and it's, it's very labor intensive. So the fact that this outside organization could condense all of those DHS rules and, requirements into something that can be completed in 7 minutes is, unbelievable.
Yeah, hopefully.
They don't mess it up too bad, yes.
So
What is
the reason that is it this, or?
Code for America is an organization that works with entities to bring in a full IT development. That was their goal, is to roll something out and then hand it.
Oh.
They'll move on and work with another organization.
It would have been,
Something else.
it would have been nice if it got handed off. I mean, they made bigger strides than they thought they were going to, but it's unfortunate because MA is really the area we get more applications for our MA program than for any other program. So it would have been nice if they could have wrapped MA into this before they handed off to the state.
Well, they know that it wasn't worth it because the state's got it so messed up. They don't want to even try.
Yeah.
So did a minute indicate that they're going to keep the portal in existence as is right now? Or are they going to taper back to prior to this.
So Christine's very familiar with this because she is on the Maxim Modernization Committee, and they've had many conversations where it's been, I think counties have been very reluctant to have the min benefits.org move off. I don't know if you can answer Derek's question.
They're not planning on replacing very successful. That's going to be continued rolled out across statewide as there's a schedule and we're already in. There's another product that has been launched called Workforce One that has some overlay, and it's a partnership with Deed. I know Mark is just giving me the look. And
Counties are not very excited about Workforce One.
If Bennett had anything to do with it,
They just completed the whole Gartner assessment of Curram, which is the underlings of the METS or MNsure, which was the healthcare application process that rolled out in 2013. Yeah. So it's hard to say at this point in time. Gartner has made some proposals of what the state needs to do to move along modernization. Opinion is it's a lot of what they've been, reorganization of the, leadership, structure, etc.
But no change to the end user, so.
well, it's the government, it's not supposed to work fast.
So some of the survey results that we've received, customer satisfaction, 71% are happy, 27 somewhat and then less than 1% are not happy or unsatisfied with their results. So comments that they've made is just thank you for your help. It's a lot better than the paper application. I like the ease of completing online. I love the new way of applying. One of the best website designs I've seen, made simple, and then just an excellent application, easy to understand for people with poor vision like myself. Those are some of the things that we've received. I know that staff survey also indicates that they really do enjoy MN benefits as well. We receive the information timely, quicker. We're able to access and get people connected with quicker. And the forms that we receive mirror what we're normally used to seeing in a different format. So, any questions?
Yeah, Mr. Chair. Do we have any idea of those that just said, yeah, what their issues were? I'm just wondering if it was because they got declined or they didn't finish or something. I'm just kind of curious on why they.
I saw earlier on, I think the happies were higher than the Ms., but we would consider them satisfactory or good results, just maybe they're just tired of interfacing with anything. I have no idea.
That could be. I was just kind of curious.
I think people sometimes would like to talk to the person, and I think this does get them talking to the person. They have to go through this process first.
And the survey results that are listed, that's for all counties currently that are in the pilot project. I do know that Code of America does reach out to us when we do receive someone that is a somewhat or less than standard so that we can follow up with them.
Which again, great service, for something like this. So we'll cross our fingers that things can kind of keep moving in the direction and not have any big setbacks.
Can we hire them and get rid of Bennett?
I am not going to say anything about Minute because I don't think anything I would say would be too laudatory.
Thank you.
Thanks, Stephanie.
Thank you.
We're flying through the agenda here. We're already on to item B, Q2 report.
Oh, not quite.
Do I miss one? Oh, no, I missed the HHS. Oh, I forgot the HHS advisory.
Yeah, and actually, I don't know if here they are. I'm sorry. I just want to call your attention. This is not a request for an approval. This is just information for you about what transpired at our Wednesday, July 28th HHS Advisory Committee. We did have a quorum, and I'll be providing some information during the director's comments about the issue that came up at the last HHS meeting regarding absenteeism and bylaws, so that's still coming. We did have a presentation about vulnerable adults. If that's something this board is interested in, I'm sure we could replicate it. We had a lot of discussions during the earlier HHS advisory committees about the elderly, especially in the last year during the pandemic, being able to reach out and get help. And so the presentation was kind of along the lines of how high the threshold really is for an adult to be found vulnerable, and that the reporting system is really directly through an online MARC system versus making a report directly to either law enforcement or Health and Human Services like they did several years ago. So it's a good presentation, and if you would like that to be brought to this board, we can certainly do that.
That would be interesting, to know what the actual process is, especially because in light of our society lately, there's more people that you sometimes question their risk to themselves or potentially others.
Great. Yeah, you know, and just for your information, and I know Jill's behind me, I think our screen in versus screen outs, I mean, even like child protection, we're used to the number, you know, how many cases we screen in when we get a child protection result. I think with vulnerable adults, that screen in is even lower. It's like in the 20-something percentile. So a lot of people, I feel like they make, and good, you know, for all the right reasons, they make a vulnerable adult report, and we can offer them resources, but less than 30% actually get screened in for further investigation. Then those further investigations don't always wield, you know, somebody's at fault. It's more just an investigation, and, you know, again, we would offer services if the investigation came out that nobody was harming somebody. So Jill, I'll put that in your pocket to remember to bring back to a future board meeting. Thank you. Unless you have any other questions, and Commissioner Hewson was also present at that meeting.
It looks like your attendance was good there. I know for a while there, last year given COVID, rightfully so, but the year before that, attendance was really kind of a struggle, but it looked better here at this meeting. I mean, has it been that way most of this year?
I'm going to hand you out, I think you have in your packet, might have some information, but yeah, there's a lot of absences, and some people who actually have not been to meetings at all, so. Yep. I think that does bring us then to that second quarter financial report.
Yes, we are now on the Q2
And I
update,
do have some
Christine.
extra copies if anybody in the room would like a copy of the report.
So Commissioner Hewson, I won't be sharing my screen right off, but I will pull it up to the Teams meeting when I get to the dashboard part. So good afternoon, Commissioners. You have in front of you the June financial statements or quarter two. We are at 50% of the year. We are at 45% of our revenues and 43% of our expenditures. Overall, that's very good. Our federal and state revenue is a little bit behind our budget when you compare it to the prior year. Total revenues last year, remember, included that 1.1 million transferred for the class and comp. So while the revenue for 2021 looks better than it does right now, most of it is that transfer in. On the next couple of pages, my apologies too, by the way, the one that was sent out with the packet included May for this report, so I'm looking at June, which you should now have in front of you in a paper copy. A couple of ones that I wanted to chat about. As we've moved from the vaccination into the budget, we've been looking at some of the different lines and why they're higher or lower than we expected. The first one is 5419, federal grants. Relocation services is what RCS stands for. Adult. MHM is Moving Home Minnesota. It's way over budget because we don't really have very many cases of that. And what we've uncovered is the state has a billing problem. So we've been receiving revenue for services that we didn't provide. So we're working on getting that corrected. It is an MA fraud thing if we don't report it, so we're working on it. Unfortunately, we were the first county to identify the problem, so we're probably not very popular.
It's not that you were the first one to identify it, you were the first one to say there was a problem.
Yeah, that could be. A little bit farther down that page, 5435, federal grants self-funds. The budget is 116,000, so it shows we're only at 31%. And that's because we received a amendment not very long ago with a short turnaround time period. I think it goes through September 30th. So staff are working with their clients on spending those for the eligible cases. Shortly below that is 5437, Federal Grants 4E program. And we've talked about this before, our 4E ratio has been dropping since about mid-2018. And we've been working on it. We've implemented some changes in the practices of when the child goes into placement and determining that eligibility. It is continued to drop. So we will be adopting some different practices starting in September. Below that, 5454 Federal Grants MCH, 5460 Federal Grants Child and Teen Checkup, and 5468 Federal Grants Public Health Waiver. Those are all reimbursed based upon our expenditures. So in Q1 and Q2 is when public health was focused on the vaccine efforts, and they weren't necessarily doing the grant level service. So that as we've moved away from the vaccine, a lot of the time is shifted back to the grants. So we would expect that over the next couple of quarters, the revenue, because the expenditures will increase in those particular areas.
So poor utilization doesn't really occur, doesn't affect us because it's, I mean, I guess it affects us if we aren't allocating the time elsewhere. But right now we're putting the time elsewhere, so it doesn't, we're not losing the.
We don't have expenditures in the grant to report to get the revenue, so I mean,
it's budgetary
it's
neutral.
not like we're losing something. On the next page, 5488 Federal Grant Rule 5. This was one thing that we identified in the budget process, is there were some billing errors that ended up unresolved for a great length of time. Part of it is a software issue that we've been able to figure out the workaround. We're not quite sure why it's not working the first time we bill. So on the next, probably Q3, you'll see a fairly large jump in the Rule 5 revenue as we've been able to catch up the last year and a half on these services. Below that, 5499 Federal Grants Miscellaneous revenue. The biggest in that category is going to be the $35,000 we received for the vaccine planning grant, which explains why the revenue is so far over what was budgeted that was received long after the budget was established last year. Any questions on those two pages? Otherwise, I'll flip. Going into the expenses on page 7, the biggest ones are going to be the 6260, which is software or systems support, and 6485, which is actually the page after, which is software under 25,000. We've had some clarity in that. Software and systems support is what's classified as software as a service. We don't physically own the software, we just are utilizing it, and we pay a user fee. The 6485 is going to be software that we own. So like for adult protection, we purchase the ScanWriter software. It's not a user maintenance license, so that one falls into that category. So for this year, we're just looking at those two together because they didn't necessarily get budgeted into the right categories. And then for 2022, we think we've got that all straightened out. And there's also the software for the contact center license is in that 6260. So that's a pretty good chunk of our licenses for the year. Under 6281, child support offset fee, that one is, it's at 70% and we're only halfway through the year, but it's a percentage that we pay when there is a child support collected through a tax refund, and so many of our non-custodial parents received stimulus funding, which we were able to capture for child support, so we have to pay a portion of that. So in that regards, it's good that it's a little bit higher. Then we have 6333, travels and meals reimbursement, meals right below that. You know, up until staff returned on the 14th, travel was pretty low. So that will trend up, but probably not come close to what we had set aside last year for the budget. On page 8, 6361, the Minnesota Care Tax. That's not as high as I would expect it, but it is trending higher because we do have to pay the 2% min care tax on our vaccine services. So that will be higher this year.
Why do we have to pay that?
All providers pay the 2%, and then it gets reallocated out and we get the money back through the SHIP program.
This is how they're funding SHIP now.
Through their own.
Yeah, but I mean, I can understand it with clinics and that sort of stuff, but with a government agency, oh, well, it's
No,
government,
because
it's government, never mind.
Because they can now, because I'm guessing they can probably get about 10 cents on the dollar on federal funding to do it that way, probably.
Could be.
Well, we recently had to
it's
apply
just-
to be an MA provider, so
The min care tax is solely within the state of Minnesota. It's taxed to providers of services within the state. It goes into a separate Minnesota state and it comes back through the SHIP grant, which is a sole state grant, not federal at all.
But the question would be though, if you're paying for the vaccines and everything through that, you can't use any of the federal funds then to pay for that tax?
So we only pay for some of our services, and it's any MA services. So, and we went through a long process of determining what was taxable and what was not with financial. And then just so the healthcare access fund is a large pot of money, and it offsets lots of costs in the state. SHIP is a portion of what is funded through that. It offset all sorts of things. Been used for lots of things at the state level. We don't, it's the service, not what you're talking about, the vaccine, that would be the.
Okay. So basically they're getting 10 cents on the dollar from the local entities then and getting to pay that 2%, because the SHIP probably isn't covering 100% of it, it's probably covering 90.
There's not a direct correlation from the tax that we pay and the SHIP grant.
No? All right.
No, because
It's a
when
source,
you look, we're
funding
budgeted
source.
to pay $5,700 for the whole year on our breadth of services, and our SHIP grant is $300,000. So we're getting far more benefit from the process than the small amount we're paying in tax.
I guess it's just kind of a goofy deal because it looks like they're taxing their own, I don't know.
I mean, so there are health departments that don't provide clinical services, right? So if they didn't immunize, they wouldn't pay a tax. So.
And we're only paying the taxes when we are actually billing and collecting the revenue. So
Okay.
if we administer a vaccine and the client is uninsured or doesn't have insurance that they notify us, we're not paying a tax on that because we're not billing and getting the revenue.
Oh, I see. They're actually just trying to keep it uniform, as if they went to a regular clinic or came to us. It's the same piece. Because you pay the 2% if you go to a clinic and got the vaccine, whether you came
Right,
here and
so
if it's
actually
insurance.
just to be clear too, some of our contracts do pay us enough to cover that extra fee that we have to pay back. They cover our taxes. So our reimbursement, I know our contract with Blue Cross Blue Shield covers that. So we're not losing anything. Basically, Blue Cross, we're the pass-through for Blue Cross to pay that tax.
Sure.
I would say when we provide healthcare services, everybody else, and we weren't paying our taxes. Where?
I get
We
it.
don't want to not tell people find fraud, so.
Mr. Chair.
Yep.
Question back on 6353 liability insurance. I take it that's a one-time?
One time in January.
All right. Because some are, quarterly, some are
Yeah.
mid-year. I was gonna say, if you're
Some things
already
are like
at
subscriptions and these
99%.
kinds of things as a one-time at the beginning of the year.
Okay, thank you.
Okay, so as I promised, I have put the dashboards now available to you all the time on SharePoint. If you go to the Health and Human Services SharePoint site,
Mr. Chair,
Yes.
before you run away from that,
Yep.
on 6620, on page 8, you've got computer or software purchases, and nothing's been spent on that, 77,600.
so 6620 is going to be software that we would anticipate be capitalized. So it's going to be software that's over $10,000 that doesn't necessarily correlate to the user license. So the AvTax professional services to do the contact center would technically have fell into this category, but we ended up covering that with the CARES funding. And I'm not sure off the top of my head what got put in that budget for 2021. But I can't think of any projects we have open right now that will meet that threshold. Most of our stuff is a software as a service now and will fall in the 6260 and not necessarily the 6620.
So one other question before we move on. Page 11 on the financial services under the 420. So it'd be 6201. The services and charges admin being 752% of the budget, so about 150,000 over budget. What's the?
Okay, could you say the number 6201 services? Okay.
Yep.
So the ones that have admin in is that allocation of the administration department within FTS. And between 6201 and 6401, we moved the rent around. It was originally budgeted in one particular category, we corrected it, and now it's being allocated through the 6201, which is what aligns with the state and federal report. So if you look at the line below it, it's
Yep.
way under budget.
Okay, now I see it, because that goes back to that debacle between you and finance, and then trying to move around where you're going to charge the rent, where you're going to actualize the building space rent. Yeah.
It'd be really nice when we get past this budget part
Yes.
and we're,
When some of those ones like that, if it was building rent, if it was titled like that, like some of those ones like services and charges admin, like it's so ambiguous of a statement that.
Right.
Yeah.
Well, when you look down to 11,480, then it is correctly classified as building rent. It's when we roll it up and distribute it to the individual departments that it becomes aggregated, and it's less easier to pick apart, but it's a lot easier to pick apart in the actual admin than it was having it split 3 different ways every single payment.
And I'm guessing a lot of these line items won't go away until the actual ERP is actually gone. Then we'll get rid of a lot of these lines that are just zeros. You know,
I
all
think in 2022, a lot of them are.
can be.
No, could you give an example?
There's a few of them here and there through there. There's
On that very first report, there are some lines that are all zeros.
because like we're getting rid of like some of the small furniture ones and something like that, right? Because there was a lot of them that we just had that. I can pull them out here. Like there's.
We have photocopying
Where
as
we'd
well.
have directions and then redirections and directions again. Yeah.
Exactly.
I was thinking they would maybe not show up then in the 2022.
As soon as we move away from this IFS report, then they will go away.
Okay.
The first report that you have is what's called a report model, and so we have to set up every chart of account that we used, otherwise there's no red flag on the report that says you don't have everything included. And so that's why we're still getting some of these zero lines where if we turn them off, we may miss revenue.
Well, I suppose because you're putting historical data in, or yeah.
Well, and it's grabbing from historical data,
Yep.
yeah.
Okay.
Okay. Any other questions on this packet of information? Otherwise, I'll switch to the dashboard then. No questions this time?
No,
All right.
Letting you off easy.
maybe next week.
Next Monday, yeah.
Okay, so on the main Health and Human Service page, on the left-hand side, there is a tab for financial report. You should all have access to the page. If you don't, please let us know and we will get that fixed. Every single month, we upload a financial report that looks identical to what you're used to seeing on a quarterly basis. So if you have free time and you want to go back out and look at it, it's there for you. Right above that is a category for dashboards, and under the quarter category is each of the different dashboards that we look at in Clear Impact. Marcus does update this only each quarter, so this doesn't update every single month. So the first one we have is our income maintenance random moment time study revenue. You'll see that for the first and second, or for second quarter now, it has dropped slightly. Last couple of quarters before that, it was going up. Income maintenance as a whole, their expenditures are down, their revenue is down. They're so correlated that while it shows a drop, it's right on par with what we would expect. For example, their reimbursement rate was at 51%, then it went to 52%, and then for quarter one of 2021, it was at 53%. So we've been seeing a decline and we're seeing it going back up. And I would expect we'll get the data for quarter two shortly, and I'm hoping that that trend continues back in the upward motion. Any questions on that? So my question for you is, this column on this side is the baseline percentage of the change. What year would you like me to set as the baseline? I honestly don't know what it is right now, but before I dig into it and fix it, I just wanted to know, do you want the baseline to be 2 years ago, 3 years ago? Then it just reflects what the change is from that baseline.
You can't, I suppose it's difficult to do it for the previous year and change that out all the time.
Keep changing a baseline?
I think so.
I don't know if that'd be that helpful to have the column if it's from some past point, you know.
I think the
From
previous year
2020 or
would give you the
something.
most accurate idea of
Right.
what things are trending.
Okay, so you want it 1 year from the reporting time period. So for this one, it would be, the baseline would be the 716,000. Yep.
Well, you're looking at revenue. You know, expenses are good to look 1 year back in trending. Revenue is so often is tied to bienniums, and that's where you want to have more of a 2 or 4 year look back, because you can see from biennium to biennium how the grant funding either
But I
grew
think,
or, you know.
but I think you're only allowed to have one baseline, or can you have more?
As far as I know, we can only set one baseline per aggregator. So we can set one baseline for the IMRMS, and we could do it for 2 years. In the out-of-home placement, that's a different aggregator. So if you only want to see 1 year for out-of-home placement, we can set the baseline for
Well,
that.
these are all 5,000, so these are all revenues.
This is all.
Yeah, these
So
are all
then-
state and federal funding, which are, you know, are relatively set on
So if you wanted-
bienniums.
So if you wanted to go
Yeah.
for like two, we could just set 2020 as, that's a nice round number.
Once we go with the new ERP system, is this gonna still be used, or is it gonna be something different then?
I don't know. I don't know when the new ERP system will be into place or what it will offer.
Yeah, I think if this is really a visual, we're using this, we're also using it like with our strategic goals and our, those kinds of things where we're looking for visuals. So it depends if the ERP has the ability to visually represent what the, you know, what we're looking at for the budget. But this is, we only use the budget for part, this is Clear Impact, and we have a new user group, so we're kind of stretching ourselves right now and trying to figure out the best ways to utilize it.
See, but these numbers don't tell us anything other than if you, unless you have the non-financial data, because they're all time study linked, correct? Yeah, so without knowing what the caseloads are, and, you know, in knowing what the elusive indicators are for the time studies.
We wish we knew those elusive indicators.
I mean, the only thing is, yeah, you understand that you have the biennium fluxings as to how much money that the state puts into these pots, you know, how they get allocated out based on the time study. Nobody knows. At least nobody's telling.
These are federal here.
These are, yeah, those are,
Income maintenance is all federal funded through the social services has some state. So Commissioner DeLayden, the answer to your question is Oracle does have infolets, which should very handily provide the same information. I don't know when, and I don't know which phase it's going to be a part of.
Well, I'm just wondering if it's even worth her spending her time on this, since it's all going to change in the future, possibly.
Oh, for like setting up
Well,
the.
Marcus has to go in and manually add these numbers each quarter, so it's not going to take him very much time to set the date for the baseline. And then it just makes this far column a little bit more valuable.
I guess I look at this, would be nice to see the revenue against the caseloads. You know, that would tell me a lot. If I looked at it year after year, a month, a quarter after quarter, here's where the caseloads are against, here's where the revenue's at, then,
Right.
you know.
Yeah, so I think this clear impact, I think we can do correlations like that. Again, it's kind of our babyhood and learning how to use it to pull in the different dynamics, but that is one of the things that drew us to this software in the first place. So we don't have that to show you right now.
But I think that would be the, I mean, because
Yeah.
the
I was gonna share
caseload is
with
really
you-
what the expense
Yeah, I was
is.
going to share with you later, and during the director's comments, our MA caseload's up like 3,500 people. So that's a big number, and that likely, would also be impacted by what that IMRMS looks like potentially.
Mr. Chair, and I agree with you in this case because of what last year was about. If anyone wants to look back at last year, are they right away going to say, well, it was COVID and you can't really go by that? Well, if that's all we got, because that's what we preset, then we don't have it. But if we agree to 2 years, then we would have one more of a normal year beyond last year, which a lot of times when we're looking at last year's things, it's, oh, it was COVID. So you don't, it's painted or tainted, maybe I'd say, with other numbers.
I hear you.
So the 2 year look back makes sense.
You'll still be able to see the 2 years here. I will go ahead and have Marcus update the baseline, which will change the percentages on the far right there, and we can talk about it again next quarter to see if that's more or less helpful or if we need to make any changes. Sound good?
Good.
We'll see if we can figure out a way to incorporate caseload size.
Yeah,
No
that-
promises.
Yeah, I know.
It'll be a good discussion for when we start that project. All right, next up then is the social service time study revenue. It is sitting at 39% of the budget. Their reimbursement percentages have been dropping. It was 16.3, 15.8, 15.8, and 15.5. So we've been doing some research on, but we really haven't, I pinpointed like one big thing that's going wrong. It may just be the overall trend of the state is dropping, which is unfortunate, but we just don't have a lot of influence in this one where it's the statewide pool.
Is this Michelle's group or Jill's group?
Both of
This
them.
is social services, yeah.
Okay, so those two are the blame then, okay.
So we're doing as many hits, or we're doing as many, all those things are still happening. The reimbursement amount is not keeping up with. We'll see. The state has a few things going on right now that might impact this.
But I mean, the question is it because we're not in a pool anymore. We are,
We are in a state pool.
We are in the state pool.
We are in the statewide.
This is a state pool.
and that all depends too, where how we are trending versus those in our pool then.
We don't have much, we're not independent here. We're very dependent on everybody else.
Us,
And
yeah.
how they're
So, I
doing.
mean, depends on how their time study shakes out against ours. It could largely affect those numbers.
Be curious to find out how the other counties are doing in this realm, you know, are they up, they trending up, are they trending down, and if that's the case, why?
So we do get the statewide pool. We get our statistics and we also get the statewide pool statistics. And in many categories, we are still trending higher than the statewide pool. There were a couple, and I mean, it's been a couple months now. But when Jill and Michelle had their supervisors review all of the time study activities, compare it to what they were doing that they reported in SSIS. And like I said, there was no major, you're doing this wrong, which is why the time study revenue, everything looked very close to accurate. And so, I don't know. I just don't know.
Okay.
Okay, targeted case management is our next one. Overall, it's continuing to trend upwards, which is, it had gone down for a couple of quarters, but we're going back up, and it looks good. I don't really have any concerns. Seems like the process, conversations between the supervisors is going well, and things are being reported as they should be.
So cumulatively, it's a budget. If quarter 3 and quarter 4 continue at this rate for revenue reimbursement, with the time studies trending towards a significant shortfall in the budget overall?
Well, we usually do a 12-month look-back period, but I suppose in some of these cases, we could look at a shorter time frame.
How did we? Not substantially.
Monday.
Yes.
I just, because I look in, you know, when you have multiple different areas that are slightly trending that way, I mean, it's one thing if it's just a quarter or two, but if you, too long, we will end up seeing that.
Yes. We will cover that on Monday. I have 2022 and my analysis of 2021 back in.
I was gonna say,
not
what's Monday?
Yeah, next Monday. But we're the first department up for the budget meeting,
Yeah,
so
on the
after
18th.
Monday mornings,
Oh, okay.
all groups.
Monday,
We're
is
coming
it
back
morning or
at 1
afternoon? I
o'clock
can't
to
remember.
discuss our budget.
Well, the county-wide presentation is Monday morning.
Morning, yeah.
It's gonna be one full day of super exciting budget discussion.
Yes.
Yeah, I gotta get something stronger.
Are you
Strategically
promising
wanted to be
it's gonna be
first.
exciting?
No, that is not what we wanted. I'm doing a favor by going first, I thought.
Really?
Guess it's how you spin it. I don't know.
All right, the waiver, there's a lot of different categories. Overall, waiver is going up. Must have flipped too many pages here. Right now, we are at pretty much at the max amount we can bill. Just with the number of staff we have that can do waiver services, they can only do so many hours in a day, and we're pretty much, this is gonna change unless there's some change in the staffing.
What do you mean, there's 24 hours in a day?
Well, you know, HR doesn't like us to work people 24 hours a day.
And just a reminder for when we go to next Monday's budget meeting, every waiver social worker brings in about $115,000 of revenue.
Guaranteed?
Pretty much. We don't have any on our request, so this is one you could put on our request if you want to add, give us a 2-pluser for new staff.
And this is the area where we had identified some billing issues coming out of first quarter, and they've been fixed and rebuilt. So we've been able to, you'll see a kind of a jump in quarter 3 that encompasses some of that. Okay. Public health quarterly, again, this one has a lot of different grants. Some are going up, some are going down. Overall, public health revenue is going up because we've been very busy billing for vaccines. The vaccine revenue is almost $170,000 to $180,000. So our team has done a phenomenal job working together with collecting the data on the application for the vaccine appointment, all the way through the PH doc, the entry on the date of the appointment and the billing, and then working to get the insurance issues worked out. So
And I really do think this is a great area. I think a lot of counties just kind of threw their hands up and didn't pursue billing the insurance companies, and we did, and that's where that 180 is coming from. So I am very proud of the staff in that regard as well.
Well, also, there wasn't, public health got some additional funding too.
Yep, but this is outside of that.
Yeah.
So this basically extends the length that those grants will last public health through the emergency response. So the largest grant we have open right now is the $746,000. Because we had revenue for the vaccine fees, we only had to bill $100,000 for the quarter, and our expenses were much closer to almost $300,000. So the 746
We're
is gonna
preserving
get
the
us-
grant by being able to bring in this kind of reimbursement.
One last one, out-of-home placements. It's sitting almost right at 50%. It's showing that the expenses went up for the last quarter, but it's a pretty small dollar for this size budget. So overall, it's doing just wonderful.
That's nice considering 3 years ago it was kind of going up exponentially, so.
Right.
Yeah.
Again, this group is working on navigating hope. We've got lots of things that we're working on to prevent having to do placements when we can. Again, probably more discussion around this at budget time.
Any other questions for me?
Thank you, Christine, very nice.
Yeah, thank you.
Now it is up for Jamie to present
Yes,
her
thank-
director's comments.
As you see, I have all my things laid out, so I do have a number of things. I'll try to make short work of it, though.
So I'll start off. I'm excited to see what Michelle's going to sing for us on Monday. I mean, she did such a fantastic job to our 2 new commissioners last year, putting her requests to music.
We thought it was all on Virgil's table this time.
It is on
so-
Virgil's table, you know. The gauntlet has been thrown down, Virgil, if you're listening.
I bet he's not. I want to just draw your attention to, and you should have in your packet, Destigmatizing Substance Use Disorders. In other words, one of our new staff, Lori Blockett's been working on this. It's on August 12th. There's 2 sessions. I think you should have it in front of you. 3 to 4:30 is for professionals, and from 7 to 8:30 for the community members. It's at the Buffalo High School Performing Arts Center. And we're just really thinking it's going to be a great event and looking for any kind of participation that we can get. Also, permanency PIP. So this is, we received a performance improvement plan requirement, a PIP notification letter from the Department of Human Services. This is around the measure % of children discharged from out-of-home placement to permanency in less than 12 months. The state threshold is 40.5%, and we're sitting at 35.9%, and that did drop fairly precipitously, I'd have to say, in this last year. I think there were some extenuating circumstances. One of the, I don't want to get into details, but working with other states with the multi-children families and things like that resulted in a number of kids not being able to be placed. So on the second page of this, you have a right to claim an extenuating circumstance. So we did do that. Wrote up about 3 impacts that we felt led us to not meet this threshold. So we're waiting to hear back from DHS to see if our claim for extenuating circumstances will be upheld. If not, we'll be pursuing the PIP and working with DHS to see what we can do to resolve that. And I'll keep you informed along the way. It's really unusual. I would say we get these all the time. We're usually here to share with you how far above the threshold we are. So I would say this is an anomaly, and it's not where we've been in the past. So we have an eye on it. Advisory committee attendance records and bylaws. I believe you should have this too. So based on a request from commissioners, what are we in August, July meeting, you should have in front of you the Public Health Task Force, Mental Health Advisory Committee, and the Human Service Advisory Committee. Each of their members, what district they represent, their start and end dates, the number of terms that they would have served by the end of the term and their last reappointment. Below that, you'll see a representation of their meeting attendance. So P, of course, is present, A is absent, and you'll see a few excused absences. I think that's one area we're going to concentrate on, is whether people have an excused absence versus an absence. So this is just for information. I did go back again based on the requests that, or the discussion we had last time, and we looked at all three of the committee's bylaws. All three of the bylaws have similar language around, I knew I was going to lose this.
Number 5.
5. So for example, nope, I'm on because I'm in the Human Service Advisory one. They all have language around if they're not present, if they have unexcused absences for 3 terms, that the committee can vote to remove them from the advisory or from whichever of the committees that they are on.
Do we want to let the committees vote them out, or do we just want to give that to the
I think
department head or the person in charge of the
chair.
the chair. I think
chair or
yeah. I think it'll work the way it is. What was more in discussion that would potentially is that the board would approve renominations, and we can present you with the information you would have on determining whether or not you want to nominate someone. To some extent, it might never get to that point. If they have multiple unexcused absences, then we would go through the bylaw process, and during the meeting then remove people from the committee if they have not met.
Well, typically, otherwise, our cleaner way of doing it is, once you've had 3 unexcused absences, you just send them an email that, per our bylaws, we ask that because you haven't been in attendance, that you would resign from the position. Because I'd rather make it cleaner where they can walk away themselves than to us like memorializing it as, yeah, we had to kick you out.
Right, and Amy does do communications like that, so we could probably put something together that would, sometimes they just leave and we don't hear back from them, and it's like, I don't know if they changed their email address or what happened, and we just don't hear from them again. So in that case, I could see where there could potentially still be occurrences where we'd have to bring it up as part of the action of the committee to remove people. But I agree with you, Commissioner Vetch. I think that would be kind of a nicer way to go about it, allowing people to resign from a committee. If they, I would think that, and we do get resignations occasionally. My interests have changed, my job has changed, whatever it is, and we certainly get those from time to time. I think sometimes people get involved for all the right reasons, and then they see kind of all of the things that we're dealing with and feel maybe they're a little bit out of their depth.
Mr. Chair?
Yep.
Thanks for showing the records here, Jamie. And I see a handful here that haven't been present at any this year. So are those folks going to be going through some type of process then, or have they already?
Yeah, I think at this point, some of the boards meet, like the Human Service Advisory Board meets on, I think it's odd numbered months and things like that. So it would be a matter of getting it in front of so yes, we would be moving forward. Maybe at this point, we could send them the email, give them 10 days to submit a resignation or something like that. And with that not being forthcoming, we would include on the board's motions to remove people that have multiple
either that or
absences.
just another email saying, are you still interested and why haven't you been?
Yeah.
And if you continued, you'll be asked to resign.
I think, and I understand Commissioner Ketchmark, I think we will be pointing at 2020 as that, that year that's an anomaly. So I think we weren't doing a lot this past year to do this. We didn't know people maybe didn't have the technology to be able to join virtually, some of those kinds of things. So, but I think this would be a good time to kind of pick up the baton again and kind of get things kind of cleared out.
I would have thought that last year would have been better turnout because it was, nobody had to travel.
Mm-hmm.
Well, it depends, excuse me, Mr. Chair.
No, you're good. We don't.
It would depend on your broadband, because I've been on meetings where it threw me out several times and I could not get back on.
We've had a few members that have joined by phone because their computer wasn't able to, and that's just difficult to be in a whole meeting by phone sometimes. So if that's okay, that's kind of the course we'll go
With the
forward.
one, you don't do much.
Proclamation. It's not a resolution, so I think it just has my signature at the bottom. It's just an awareness for the board that August is Child Support Month, so you see a proclamation in front of you. I also have Karen Popkin, our Child Support Supervisor, is with me here, and if you have any questions for her regarding the information you see on this handout, which is kind of our, I would say, a very positive demonstration of what our child support staff do. Our collections, we collected $11.4 million in child support. This past year in 2020? Yep. The highest amount of that is coming through income withholding. We have 3,480 cases, child support cases in Wright County. Their mission is to locate parents, establish paternity, establish orders, and collect support, kind of in that order. And then we have our performance measures, and looking at this briefly, it looks like Wright County tops the state all the way through, with the exception, I would say, being program effectiveness. Trying to think, Karen, can you explain the program cost effectiveness?
The amount of money that.
I know, I'm thinking, is the little number better or is the big number better?
The big number's better.
Okay, so we exceed.
Yeah.
So for every $1 I remember now, for every $1 that we expend in the child support program in Wright County, we collect $6.48. Statewide, for every $1 that is spent for the child support program, they collect $3.26. So
Boy,
we
you
have
guys better run the ball.
yeah, we about 100%, we about 100% outperform in that program cost effectiveness. Some of that has to do with the size of our counties. Obviously, smaller counties aren't going to be very effective, cost effective, because they have to have more staff to collect less money from fewer cases. So, but we do a really good job in that cost effectiveness
Are
area.
those numbers gone up? I mean, the numbers of kids that you
No.
have actually supported, or
I would
is it about the
Actually,
same?
opposite. It's kind of trending down. Statewide, the child support case loads are trending.
A number of years ago, you had to have a county case open in order for them to collect from your employer. And people were able to opt out of and so we did have some folks a number of years ago opt out. I don't know what post-pandemic will bring, if we'll have more divorces and ergo more child support cases, but no, I would say we have Kim has been very forthcoming, and we have, I believe, already reclassified a child support position into another position, and we might be bringing another situation like that
Commissioner
forward.
Hewson? Christine? Yeah.
Oh, yeah, I just was wondering about the proclamation. It says Governor Mark Dayton. So was that something you originally did, or am I looking at the wrong thing?
So the proclamation is typically signed by the current governor every year. It just hasn't been signed yet this year. So that's probably my fault in giving Amy an old version. It will be signed.
Are you sure?
It's still August.
It has been.
Yeah,
so-
it's still August. Maybe by August 31st, we'll get the newer one.
The third week in August before, but we didn't want to wait until the end of the month to provide the board with the information about child programs.
Did have one more item, and I saved kind of the best for last, I believe. If you recall, many conversations we had over the course of time when DHS got in trouble for overspending, I believe it was around substance use disorder, and then they asked the counties to pony up the money, and the counties kind of said, no, we don't want to pay back for the DHS error. And then this last legislative session, the legislators put 1.8 or $8.1 million into the fund to make DHS whole and not hold counties harmless, since we didn't create the issue. So we will either have or we will be receiving $89,234 of the clawback money. So if this didn't make any sense, if you recall the term clawback, that's what this is referring to.
Well, we won't really receive it.
We never spend it, right, but they won't ask us to. reimburse them.
I can remember that discussion.
Yep. It was I would say in the legislative session, it was a hot topic because DHS was in a lot of trouble for spending money way over and above and with little parameters around it, and then them wanting counties to make good on it, so.
Yeah, and some of the money was spent was not in
Right.
us. It was
Contracts
out-
weren't really valid and things like that. So this was a win for the counties. You know, I think it's good. I would have been coming out of my budget, so I'm happy that it's not. The other thing I had on here was just, and we'll bring something maybe to a future meeting, it's just, again, just noting that our MA numbers have increased by like 3,500. It's kind of a ballpark estimate. So, however, with 3,500 new cases, and typically like back when I started, 350 was kind of the ballpark caseload for individual workers, that would mean like 10 new workers to handle 3,500 new cases. But with the implementation of OnBase, with the new contact center, and with Kim reorganizing into case banks, we were able to take in the 3,500 new cases without adding any additional staff in that area. And that's not the story a lot of other counties are out there talking about. So I'm really kudos to Kim and her group for kind of keeping it all in check, doing what was needed to be done during the time and finding efficiencies.
And with Minute taking over this other software, they're gonna improve it and help it out. even
Yeah,
more,
that's gonna be
right?
wonderful.
Actually, I think that Maxa is really pushing back. You'd
We
be
are.
shocked. The counties are starting to push back,
Good,
big time, and are standing our ground and saying, no, we're not gonna take it anymore.
good. We have to.
Yeah.
I mean, it's just utterly ridiculous that they build something that is absolutely worthless.
And like you said, it's kind of a teaser. You bring out this great thing and then, you know, see what happens. But maybe Minute will surprise all of us.
I'm not gonna hold my breath.
Yeah. Anything else come before the Health and Human Services Board? If not, we will stand adjourned at 2:51.